Hi everyone, my name is Marianne Curry and I am a PA, physician assistant in general internal medicine in Marion, Ohio. I actually live in Delaware County and I am a volunteer provider for the Grace Clinic Delaware. And I wanted to talk to you guys about a couple of things today. I first wanted to say how proud I am of all Ohioans and Delaware County residents and Americans in general for doing something that was asked by our federal government back basically in March. So when the coronavirus began to spread throughout the United States, government officials and federal health officials urged Americans to delay their routine appointments, their testing, even their routine cancer screenings. And as Americans, we heeded those recommendations. We said, okay, we're going to stay home. Are these shelter at home orders, and we're going to stay home until otherwise notified. And we did that. And with that, for those several months that we as Americans did that, we are actually seeing that we had a drop in cancer diagnoses, certain cancer diagnoses. And we're seeing now that that was most likely just due to the fact we didn't have those screenings, so we couldn't make those diagnoses because we didn't have the testing done. And so although those numbers have dropped, it doesn't necessarily mean that the cancers weren't there. It just means they weren't yet detected or they haven't yet been detected. So now that the stay-at-home orders have been lifted, we are seeing that patients are still not scheduling their mammograms, their colonoscopies, their skin exams. They're just not doing these routine cancer screenings or wellness screenings. They're just, most likely because they are afraid of being exposed to COVID-19. Rightfully so. But we need to remember that even during a pandemic, cancer does not take a break. It doesn't take a nap. It doesn't pause. So now it's time that we go ahead and call our primary care physicians or our oncologist or our radiology departments. We need to get scheduled for those preventative wellness exams, those mammograms, those colonoscopies. We need to get that done. October is Breast Cancer Awareness Month. So ladies, please get your mammograms, get those scheduled. And on a personal note, my mother was diagnosed with breast cancer in 2002, and she was diagnosed with cancer based on her mammogram that was done exactly 1 year to the date from her previous mammogram. So she had a mammogram, all clear. 365 days later, she had a mammogram, she had cancer. So I'm happy to report that she is an 18-year cancer survivor, but we aren't going to have those results if we're not getting in and getting those screenings, because we know that early detection is the best protection. We've got to get in, we've got to get those done. But beyond our routine cancer screenings, our preventative, our wellness screenings, we need to also remember that even during a pandemic, we are still going to have medical emergencies. And people are still sheltering in place and practicing social distancing, which is great. That's what we need to do to keep our numbers down and to flatten the curve. However, that doesn't mean you need to put your medical issues on hold, okay? So what should you do during a crisis if you need medical care that is potentially, it's unrelated to COVID-19? So hospitals around the globe, in every country, every state, they're treating an influx of people with COVID-19 and related symptoms But that doesn't mean that they're not treating emergencies too, like just regular other emergencies too. If you're wondering whether it's safe to seek medical care at a hospital or a clinic during the coronavirus pandemic, the answer is yes. Yes. There are concerns that people experiencing, life-threatening conditions such as a heart attack or a stroke, they're delaying seeking care out of the fear that they might contract the coronavirus at the hospital. Or they may be worried that they are just going to be an additional strain to the medical system. That maybe they're not essential. This is not an essential issue. What we want you to know is that the emergency room is there for you always to treat an emergency. If you're experiencing an emergency, they are there. So let's talk about when should we go to the emergency room. If you are ever questioning if you should go or not, call your primary care physician, call the ER, call your local EMS, call them and decide if you think you should go, if you're even questioning it. But let's talk about things that would take you to the emergency room. Chest pain. If you are having chest pain, difficulty breathing, you should go to the emergency department, regardless if it's COVID-19 related or not. If you are having weakness or numbness on one side of your body, go to the emergency room. Slurred speech. If you've fainted, if you or a family member have a change in your mental status, serious burns. Burns are an emergency. I'm not talking about like, oh, I burnt my finger on my curling iron. If you have a large portion of your body that's been burned, that is a medical emergency. Head or eye injury, you need to seek emergency care. If you have a concussion or you have a head injury that causes confusion, or if you're just confused for no reason, again, medical emergency. Broken bones, dislocated joints, a fever with a rash, severe cuts that might require stitches, facial lacerations, severe cold and flu symptoms, a high fever with like severe body aches, unable to keep food down, potentially dehydration. I'm not talking about I have a little runny nose and, I cough twice a day, but severe symptoms. Any issues with pregnancy or vaginal bleeding with pregnancy, reason to go to the emergency room. We talked about, broken bones, a fever in a newborn, especially if they're less than 3 months old. That is an emergency. A loss of consciousness, poisoning that maybe is not able to be handled by poison control. Maybe you call the poison control hotline and they will probably tell you if you need to seek medical care. But if you've had any type of poisoning, emergency room. Seizures, fainting, a serious head or neck or back injury that could potentially lead to paralysis. Those could potentially be life-threatening, and you should seek emergency care. But signs or symptoms of a heart attack or stroke, sudden onset of severe pain, especially abdominal pain. Those could be signs of appendicitis, which will require an emergency surgery, an abdominal aneurysm or dilation that has ruptured. Any sudden onset of pain that is unusual and is severe, you need to go to the emergency room. So, under no circumstances should you avoid going to the emergency room or calling 911 if you feel that your symptoms are truly an emergency or they're very serious. Do not delay. Even if it's clear that you or your loved one needs emergency care, you may be unsure of whether you should drive to an emergency room or call 911. And if ever in any doubt, call 911. It's important that you get to the emergency room quickly and safely, especially if you're experiencing chest pains or severe bleeding, or if you feel like you might faint or you have trouble with your vision. You need to get to the emergency room, but it may be best for you to call 911. A lot of times it's just best to call 911 because an emergency that would send out an ambulance or might be the right decision because they can provide some life-saving treatments on the way to the hospital. So please be assured that our hospitals and healthcare facilities, including the emergency departments, they are taking measures against COVID-19 to enhance and ensure safety and minimize the spread of any communicable disease, not just COVID-19. Okay, so what are they doing? Well, they're isolating patients with COVID-19 or related symptoms. So emergency rooms and clinics and hospitals have reconfigured to keep people with COVID-19 or related symptoms in a separate designated area or unit. They are enhancing COVID-19 screening. So screening for every person that comes into the clinic and hospitals, including staff members. This includes screening for, respiratory infection, or their temperatures are being checked at the door. And it's not just visitors, it's, staff members as well. And then, so staff PPE, the personal protection equipment has been upped. Like the game has been upped, and everyone is taking precautions, double precautions, triple precautions that would minimize any exposure or spread of COVID-19. Mandatory face masks. So if you are coming into a healthcare facility, a hospital, emergency department, you're going to be required to wear a mask. If you don't have one, most of the time they're going to be provided for you, but everybody needs to wear a face mask. And then limiting visitors. In the beginning of the pandemic, visitors were, they were just completely prohibited from visiting people in the hospital or accompanying people to the emergency departments. And it's been very difficult for a lot of families, especially that may have experienced a loss of a loved one, particularly if it was related to COVID-19. We've seen stories all across the country of iPads and FaceTime that these selfless nurses and medical staff have, provided for the families that are at home. But it was for, the betterment of others. And so now some of those restrictions have been lifted, but the visitation is still restricted. There are still guidelines and restrictions in place for that. And then there is also social distancing. So waiting rooms and these exam rooms have been reconfigured, and the space between the chairs have been expanded so that everyone can stay at least 6 feet apart and practice social distancing. So those measures have been put into place. And extra cleaning measures. You're seeing the housekeeping staff cleaning constantly. They are turning over rooms, they're cleaning and then cleaning and then cleaning again. And they are just really following these rigorous cleaning and disinfecting protocols so that we can ensure safety with all people that may need to encounter the emergency department, or if they are being admitted to the hospital, or if it is for even just a routine screening exam like a mammogram. Extra precautions are being taken across the board so that people feel safe, and we know that we are limiting any potential exposure to COVID-19. So that at the end of the day, we need people to not be afraid to seek medical care now during the COVID pandemic, but frankly, anytime. Because you can never be too sure. And if you go to the emergency department, it's a false alarm. They say, oh, well, it's not a heart attack, it's just indigestion. Great. That means that you're doing just fine. However, you wouldn't know unless you went. So if there's ever any question, go. It's better to be safe than sorry. Any day of the week. There's not a healthcare provider, a family member who would ever doubt you or tell you you were wrong for for seeking medical care if you felt like something was wrong. So what are a couple of the major things why we seek emergency care? Surround like two big things, stroke and a heart attack. Those are the two big ones that we hear about. So we're going to talk about stroke briefly. And so when you think about stroke, you want to think fast, F-A-S-T. So what does the F mean? The F means facial drooping. So if you notice that the person is having like a drooping on their side of the face, you can ask them to smile. So right now my smile is even, but if their smile was uneven, one side was drooping, one side was smiling, that could be a sign or an indication that a stroke may be occurring. So with fast, we're gonna go to A, which is arm weakness. So you can ask your family member or loved one to raise both of their arms. Does one arm drop lower than the other? Are they equal? You want to look at that and see. So an arm weakness could indicate a stroke. And then S. So we've done F-A, now we're at S. S is for speech. So is that person's speech slurred? Is the person unable to speak, or is it hard to understand them? So you could ask that person to say a simple sentence. Just could be, how are you today? Hello, my name is Marianne. Whatever it is, just have them repeat a simple sentence and see if you can understand them or if it's slurred. And then the T is time. If the person shows any of the above symptoms that we talked about in the F, A, and S, and even if the symptoms might come and go, wax and wane, the T means time. Time to call 911 so that they can get to the hospital immediately, because time is brain tissue. And if we can get to the hospital and start the appropriate treatment, we can sometimes reverse the stroke. But we have a very, very short window. So what are some additional symptoms of stroke? Okay, so sudden numbness of or weakness of the face, the arm, the leg, especially if it's all on one side of the body. Sudden confusion, trouble speaking or understanding speech, trouble seeing, if you are having trouble seeing out of one or both eyes, trouble walking, sudden trouble walking, dizziness, loss of balance and coordination that comes on very suddenly, or a severe headache that the patient has never experienced before and has no known cause. They don't have any history of migraines. They just have a sudden onset of a headache that is very, very, very difficult for the patient. These are all reasons why you should seek emergency care to make sure that you're not experiencing a stroke. And then the other big one is a myocardial infarction or a heart attack. So there are various symptoms that could happen, the most being discomfort or feeling of pressure or fullness or squeezing in the chest, especially in the center or to the left side of your chest. If it lasts more than a few minutes, or even if the pain goes away and then it comes back, these are reasons you should seek medical care. Pain and discomfort that extends beyond your chest to other parts of your upper body, particularly your shoulder, your neck, your back, your stomach, and particularly your jaw. Those are things that could indicate you're having a cardiovascular event. Unexplained shortness of breath, with or without chest discomfort, should always be evaluated every single time. If you have difficulty breathing, that's an emergency. You should seek emergency care. And then, of course, any of the symptoms that we just talked about that could be associated also with a cold sweat, nausea, lightheadedness, anxiety, indigestion, all indications that you might be experiencing a cardiovascular event such as a heart attack. So those are reasons why you should seek emergency care. If you're experiencing a true emergency, please seek emergency care, especially during a pandemic, because the emergency departments are ready for you. They are safe. They are taking multiple precautions to make sure that the spread of COVID-19 is minimal. And like I said, if you don't know for sure and you have any questions, call the ER, call your physician, call the EMS department, and see whether or not you should seek medical care. But if you're ever in doubt, always go. Please schedule your preventative cancer screenings. And because listen, we want everybody to live the most healthy, the longest lives that they can. And we wish you all the best. And we hope you're having a fantastic week. And thank you very much for listening. Take care.